the patient cough until the vocal cords will open, and then assuming we're able to reach the appropriate place, we're gonna try to suck until we sense secretions coming in the suction catheter. And then make sure we should not do it more than 15 seconds. It should be less than 15 seconds when doing suctioning. And then when doing the suctioning, make sure we also not try to do a circular with the catheter because it might lead to any complications such as bleeding. And then once you're done, carefully remove it and then try to reoxygenate the patient. If you want to do multiple attempts, it should not be more than 3 attempts. Assuming we're done, have to remove this one carefully together with the sterile gloves, and then remove it all together and then dispose it. And then make sure we rewash our hands and then wear another gloves, clean gloves, and then we have to turn off the regulator, and then we have to set this tubing back to its appropriate place. The tip should not be able to touch the floor. And then once you're done, try to observe the mask if it's functioning, if it's inflated, and then make sure we dispose all of it in here. And then with the PPE, make sure we also have to dispose it in the proper waste disposal. So once you did those, make sure we always do our post-assessment. Make sure we obtain any vital signs such as the SpO2 and heart rate, and that way outcomes would try to increase their SpO2, and then heart rate would not be more than 100 or tachycardic. And then listen to the breath sounds. So potential outcomes also after suctioning is the breath sounds will be cleared up from any abnormalities in their lung sounds. And then once everything is done, once outside, of course, rewash again our hands, chart everything, what we did to the patient, what our observation is, and try to document everything and coordinate with the staff.